is going on with the council, but we don't have the authority to speak for them. The time frame for age-friendly New Jersey came from a resolution that the governor presented in March 2021. And the council's first meeting was in March 2022. The resolution said we had 18 months to deliver a blueprint on best practices for advancing age-friendly practices across the state to the governor. What was actually included in the resolution were four items: to identify opportunities for and barriers to the creation of livable communities for people of all ages in New Jersey, recommend best practices for age-friendly employment and civic participation for government and civil society, promote age-friendly community inclusion and equitable outcomes, and ensure programs and practices address disparities experienced by older adults across intersectional social positions. The council is chaired by the Commissioner of the New Jersey Department of Health or his or her designee. Right now it's Melissa Chalker, who is, I think, Deputy of the Department of Health. It is staffed by the Division of Aging Services, staffed by the Division of Aging Services with personnel from other agencies, and includes leaders from the private sector and civil society. Emily, are you on now? I guess not. She was going to be presenting about this. The council is made up of representatives from state government, local, and the private sector, as I just said. And here it shows who actually is involved. It's representatives from all of these departments. So far, we've only been meeting by Zoom, which if you live and work in New Jersey, you know that it's a real bonus to not have to meet in Trenton. So not that we don't like Trenton, but it's just always a pain to get there. It takes a long time from North Jersey, and I'm sure from South Jersey as well. But we have representatives from Housing and Community Development, including the Department of Community Affairs and Housing and Mortgage Finance Agency, long-term care with the Ombudsman and the Long-Term Care Resilience in the Department of Health, Planning and Transportation, the Department of Transportation, New Jersey Transit, and the Office of Planning. And other departments are the Department of Labor and Workforce Training and Division of Aging Services and the State Council on the Arts. We also have from local and quasi-local, quasi-government, the Mercer County Transportation Management Association, New Jersey Association of Counties, Ocean County Agency, Area Agency on Aging, and municipal. I represent age-friendly Englewood. Although we are private, we're not embedded in city government, and the Piscataway Senior Center. And then from private sector and civil society, we have businesses, which is the food service supermarkets. Higher education, we have the Rutgers School of Social Work, and I think we may have another university too, but I can't remember. And several nonprofits, AARP, certainly, the Alzheimer's Association, Brain Injury Alliance of New Jersey, Disability Rights New Jersey, Family Resource Network, and I can't read the last one because it's not on my screen. It's cut off by my, Hudson Pride Center. And we meet monthly online. So far, our work, we've been divided into, Emily, here you are. Why don't you take it from here?
Sorry, Janet, you can keep going. I was just troubleshooting. Now Zoom's resolved, so we're okay. Yeah, thank you so much.
The slides you were going to do. Do you want to talk more
Sure.
about it?
Okay, yeah. So this is what the, do you want me to go?
I just presented this.
Okay.
But do you want to add anything else?
No, I mean, I think it's good to kind of think about the advisory council as kind of having about half its membership as public sector professionals. And that's why we're, it's good to conceptualize this really as like a state level public sector initiative. But importantly, there is representation from individuals and organizations and systems outside of the state government. So if you go on to the next slide, there are some, voices from a county level as kind of a different scalar, but very important unit of organization for age-friendly work in New Jersey. And then 2 municipal voices of people kind of doing more local municipal level efforts also as part of the council. And then in the private sector, largely representation from statewide nonprofits, interestingly focusing a lot on disabilities, but also aging and others. like the Hudson Pride Center. Currently, the Rutgers School Social Work is the, kind of the voice from higher education, and also one business leader as part of the council. Janet, you want me to keep going?
Sure, I just started this when you joined.
Okay, yeah, so how our work is actually playing out is through monthly online Zoom meetings, basically, that have been going on since March of this calendar year. And are scheduled out really, I think, until July of next year. We have meeting dates. We meet on the first Tuesday in general, the first Tuesday of every month. And our colleagues in the Department of Human Services Division on Aging host the meetings. It's really staffed by them. They're organizing the Zoom, setting out the agenda, sharing communications by email in between meetings about the next meetings. And much of the work has focused, like in terms of what we actually do in our 2-hour Zoom meetings. There's kind of two categories of things. One is the SWOT analysis that's been taking place across multiple monthly meetings. And then especially recently, having guest presenters help members of the council learn about particular aspects of this really big work. So with respect to the SWOT analysis, that's strengths, weaknesses, opportunities, and threats. All council members have been assigned to one of 5 work groups that roughly correspond to the domains of livability and age-friendly as promoted by AARP and WHO. And the members meet intensively, like for at least an hour each meeting, first brainstorming the SWOT and then refining it. We've done a SWOT swap where different groups, pairs of these committees trade each other's ideas, or we hear from a guest speaker and then update the SWOT analysis with respect to the domain that we've been assigned to work on. And we've had 2 kind of formal guest presentations so far. One was from several of the age-friendly leaders in Bergen County municipalities, as well as the Rutgers School Social Work of kind of this, what we've learned from bottom-up efforts. And that seemed to be well received because so many of the members of the council are at the state level and might not have had the occasion to really understand what work on aging at the local level looks like and what it takes to do that work well. And then at our most recent meeting, we had Cassandra, I don't think she's here, from CSH talk about supportive housing and aging in New Jersey, and some recent policy developments that might affect that work, like Medicaid waiver and COVID-related federal funds, and unmet needs and opportunities in that area as well.
And that's it. We are open for discussion. As I said, Emily and I are both presenting on behalf of ourselves and not necessarily on behalf of the state government. But we're happy to answer any questions that you may have about this work. I'm going to stop sharing my screen now.
Yeah, we have a healthy 9 minutes for discussion. So if people wouldn't mind turning their cameras on, if they're able to, and unmuting to discuss. We're interested in hearing what brings you to this session and what curiosities you might have. We're also happy to take your comments to our colleagues on the council. We told the membership that we would be doing this and that we'll report back. I think there's a big part of this work to be done around public engagement and kind of connections with civil society more broadly with age-friendly community work, and you all are part of that in large part. And so we really do want to use the little time we have together to hear from you on what aspects of this work you're interested in.
I think it's very interesting from working at a strictly municipal level in Englewood and working at the state. As a local nonprofit, working under the auspices of a nonprofit, we can be very nimble and pretty much get things going really quickly. If we find a good idea, we can just do it. And how much longer it takes to get anything done at the state level, certainly, and most likely also at the county. I see Michelle Diorgi on here from the county of Bergen. It's just so much easier when you're working as a small, nimble little nonprofit. You can do a lot. And it sounds easy to get things done, but it just takes a whole lot more time when you're working through government.
Yeah, there's a reason why they say change is slow. But I think it's also important to say change is slow, but also possible.
Yes.
And the idea is just to kind of keep at it together and, you know, keep moving forward. All we have is the time we have. And I really feel like from my vantage point, to achieve the kind of transformations in the 21st century that we know are possible for systems for aging well in the community, it will take the work of lifetimes. You know, it's work that transcends any of our own geographies, any of our own, you know, time on this earth. But we do what we can, however we can, while we can. And that's kind of the spirit, at least I personally am going at it. So just want to acknowledge Stacy Callahan is here. She is a member or staff on the council and comes to the meetings as well. So thank you, Stacy, for being here and for your important role in developing the blueprint, which is a major deliverable of the council.
Thanks, happy to be here. Been enjoying a lot of the breakouts and seeing all the efforts, and I'll go back and look over everything I've missed in the other breakout rooms. It's really interesting topics today.
Thanks, Stacey.
And on the council, it's really interesting to hear the points of view of so many people in a broad spectrum of the society. Michelle, I think you had your hand up.
Yeah, I just wanted to say thanks, especially working with you and Emily, and for our meeting yesterday. I was really curious to see the state's version and the council to see how we can try to mimic it.
I mentioned that I was going to be sending you some information, and
Yep.
this is what I'm going to be sending.
Yep, perfect.
Yeah.
Because we were on another call when we were presenting, David was presenting in another breakout room, and there was discussion about hearing loss and so forth. And he wasn't even aware of some of the initiatives that we're already undertaking, like that loop. We're already looking into that. And we do refurbishing of hearing aids with one of our local universities. So it's sometimes, like you said, it's a slower process because there are approvals, there's funding, there's legislative body, there's the county executive. So it is interesting, and we have our other committees and where our nonprofits participate at the very basic level of the Division of Senior Services. And at the county level, we have 30 plus advisory boards on a variety of subjects, everything from human relations to veterans to Asian, African American. So like hearing and trying to get everybody, just like we were talking yesterday, to look at everything through the lens, which is now our focus. We have a department head meeting in a little while, just making sure that everything is always focused and not predetermined on what our aging population, what our partners in the community want to hear. And I kind of beat that dead horse all the time, saying that, you know, seniors are different. I look at my mom and dad, I look at Janet, like there's different levels and interests and so forth. So sending parks information to our residents and not just sending information on, let's say, homebound food distribution, Meals on Wheels, right? So I don't want to predetermine what someone in our communities need. They should be seeing everything. And that's one of our bigger frustrations, I think, here, making sure that all information is universally dispersed. So all the programming is shared with our community. So hopefully when we have our community stakeholders, and I see the version that you all used at the state level, which will probably mimic, and we kind of, I think, already have that going forward. We just want to improve our programs.
It's amazing to hear you reflect on all that. There's so much I could say in response, but I'll just pick one thing because I see Hannah has her hand up and we have a couple minutes left. Just that I think part of the paradigm shift that Age Friendly both presents as an opportunity and a challenge is that aging as an issue is just so multifaceted and so multi-sectoral. And so it really challenges this notion of like, oh, we have a division on aging that, you know, helps some people and that's So we're doing what we need to do as the public sector in aging. It really pushes beyond that and tries to lead with the strengths that aging services has, and is so close to the people who are benefiting from public sector leadership more in this space. But at the same time, making all departments in public, sector have the capacity and be aware and be accountable for addressing this major segment of our population. And then also challenge to, so there's kind of this internal government piece to the work, and that's what the State Advisory Council in large part, I think, is at. But then there's also this kind of multi-level work too, where it's, the state offers services, the county offers services, the localities offer services or benefit. And really, this is, I think, even the harder part than multi-sectoral. The more challenging piece is aligning those systems levels, because I've seen in New Jersey, we're just not really wired to have a lot of coordination between state, county, and local. And in fact, I've heard like county workers talking about state programs and getting slack about like, what do you work for the state now? There's kind of like different teams or different silos, and people want to like kind of stay in their lane. And that's exactly what's going to prevent us from making systems-wide progress and reaching the people who we need to reach the most. So Age Friendly is really just a banner for kind of like stepping back and innovating kind of more broadly in terms of how we position what these puzzle pieces are and how to position them more effectively together. And I just want to applaud both the state and Bergen County as two early examples in our state who are trying to grow in this area alongside others. Yeah. So Hannah, you have your hand up for a while.
Ooh, we have very little time. I just wanted to thank you both for this presentation. And I guess my general question is for us as advocates, like how can we get more involved in this work and help to inform the blueprint, and like how can we connect with you? Like what are you looking for from advocates?
Really quickly, I would say, like, Hannah, your work, it would be great I would recommend you as a guest presenter to the council at one of our monthly meetings. Like if you have particular expertise in one of the domains we're looking at, I think just coming to a council meeting and speaking to the body as a whole would be a easy enough, reasonable thing to try to do. And I'm happy to follow up with you.
And one of the points that the governor made in the resolution was for equity in aging as well. So it's very important that we hear from you.
Great, would love that. Let's follow up and connect. I'm so
Yeah.
glad this is happening. Great.
And others, open invitation, just email us if you would like to connect.